Alright, well first we're just going to go through some general observations that you should go through with all your patients on day one. So first, if I'm just looking from the front, I'm looking for just level pelvic height, you see if there's any kind of lateral shifting or anything like that going on that could be coming from the spine or the hip. I'm looking at the hip versus the knee angle to see if there's kind of that valgus positioning. Not much of a problem with Chris here. I have them take their shoes off, please, and look at their the arch of their foot, if they're real flat or if it's really high, and how that's affecting the knee. You know, if it's super flat, if the whole knee is kind of rolling in, or if it looks pretty stable. Another thing I'm going to look at is if you have a lot of hip internal rotation, sometimes you'll compensate by kind of toeing out. So I'm just going to kind of look at that as well. From the side, you face that way for me. I'm just going to look at if they've got a lot of anterior pelvic tilt or posterior tilt. Chris has got a little bit more anterior tilt than most people. So just looking into where that could be coming from. You're going to look at the knees to see if there's a little bit of that flexion contracture or if they hyperextend, to see if there could be some either hypermobility or flexion restriction or something like that. And then if you turn around for me, sorry, facing that way. Again, you can kind of look at the dimples in their back too to just give you an idea on level pelvis, just starting out pointing that lumbar spine. Look at the hips. You can look at where the gluteal folds hit to see if there's like a significant variation going on there. You can also just look in general, you can turn back around, at leg length difference if they're really upshifted on one side versus the other. And that can be a good place to start. So some quick functional tests that you can go through. Anything can be a functional test. Whatever their asterisk sign is, whatever hurts, just have them do that, and that's your quick functional screen. But some pretty common ones are just a squat. So I'm going to say, can you just give me a nice normal squat for me? So you're looking at if they have enough hip motion to really sit back with that activity, if their knees are going over their toes, if their ankles start to pop up, if their toes start to pop off the floor because they don't have enough ankle motion, if the knees start to come in. I'm looking at all of those things to think about, you know, a hip weakness or a hip joint restriction if they don't have the motion, or something at the ankle maybe. Another really common one I do, I like the step up because you can look at the same kind of things you just looked at the knee control, the strength, is it more painful with weight bearing, but I also really like step down. So can I have you come on this first step here? Then I have you just step down. This is a good one because you can look at, again, the valgus control and that hip stability for the knee, but you can also look at, it gives you a good idea of ankle mobility. If they're coming down off the step, and that toe just immediately, that heel pops off the second they try to step down, they might have more of a towel curl mobility restriction or maybe a calf muscle restriction or something more at the ankle. Other ones that I use a lot are more kind of dynamic functional. You got like a squat jump or what's the other one? Single leg hop, box jumps. These are all ones I've just done today with a couple of kids. Looking at a lot of that knee position, body control. Are they getting their hips back? Are the ankles stable when they're landing and they're not wobbling or rolling in? So those are some good ones. Single leg stance is another good one. So if you stand on one foot. You can see if that hip just drops to the other side, if there's some hip weakness, or if the ankle is really rolling in and out a whole lot, there might be some ankle instability. So just those kinds of things. Those are probably the main ones that I use, but really if your patient says, my most painful thing is when I kneel and have to get up the ground, then that's going to be your functional test, just whatever is painful for them. Okay, next we're going to look at how to differentiate some of the lumbar motions on whether that pain is coming from the spine or the hip. So the first one we're going to do is flexion. So what I'm going to have you do is just kind of bend forward for me like you normally would. Can you roll your shirt up for me, please? Thank you. And then come back up. And you're just going to kind of look and say, oh, where did that hurt? And they'll let you know. So how do I differentiate between the back and the hip? So one trick that I use a lot is to off-weight the hip. So I'm going to say, can you put your foot up on this? At home, at work, you can use like a step or a block. Here we're using a chessboard because that's what we have. And same thing, we're going to just bend forward and see if that changes the pain, if it makes it go away or if it's less. Good. And then back up. Another thing you can do, if that doesn't maybe tell you it, is I can kind of get my hands right here and block that pelvis from tipping forward, and then go ahead and bend forward. Good. And so that's going to be more lumbar. I'm taking the hip out of it. Come back up. You can also tell your patient, try to keep a really flat back and just lean forward. Let's see if that changes things. So he can't even do that. So I'm definitely thinking that there's a mobility problem there. So how about you face this way for us so they can see. You can do the same idea for extension. So I'm just going to have you extend back for me and just look at the general motion. Yep. Good, get an idea on that and if whether or not that's painful. Then same idea, you can have them offload that hip and extend, see if that takes away the pain. Maybe it's more of a hip joint issue and when you off-weight it, it does better. You can also, same idea, get right behind them, block that pelvis pretty good and then have them extend. Yeah, good. And see if that's more coming from the lumbar spine. So for rotation, you can have them go ahead and rotate. I can block that pelvis and then bring your arms back, like your shoulder back towards the other direction. Yep. So that gives me more of a hip idea because I've taken the lumbar spine out. The other option, face forward, is you can block here and then say go ahead and turn, not letting that hip move. Then you're looking more at lumbar spine. Another thing you can do is stand on that right foot. You can hold my hands and kind of turn their whole body to see. So keep your shoulders straight on towards me, and rotate all together. Take some cueing. Chris isn't great at it, but that can tell you it's more the hip versus the lumbar spine. The only other one is side bending. I would actually love to see some other people's ideas on this because that's not my favorite one or my best one. So I'm just going to have you kind of lean to the side for me. Don't know if that's the problem. You can, again, put that foot up. Always a good idea. Or go to the side for me. Again, just looking at that hip joint, if it's really locked up and tight, or maybe like an OA or intra-articular problem. You can also, just like always, block the pelvis, go ahead and side bend, not letting those hips go with them. And those are a few options. The last one is quadrant testing, which is kind of combining all three. So you're going to take your right hand on the back of your right leg, you're just going to kind of slide it back. Okay. Now if that's painful, we don't know why. Same idea, come in, go back up, standing up, block that pelvis, see if it's more of a back. Or you can kind of slowly add things one at a time, so I'm just going to have you extend. Nope, just extend your back, thank you. And then rotate to the right, just kind of slowly adding in each piece, and then come back. Again, I'd love some ideas on quadrant and how to further differentiate, because that's not a strong suit either.